Thoracic X-rays are used to evaluate soft tissues of the thoracic cavity, such as lungs and heart. I'll start out by entering the patient's information into the computer, placing the patient's name, the owner's name, the identification number, if it's a male or female, and then I select which type of X-ray I will be taking, in this case a thoracic lateral. I will begin by measuring at the highest point of the patient. Once I have received the measurement, I will use my technique chart to insert the settings on the X-ray machine, and then I will select my collimation. The best position to evaluate the heart is dorsoventral, and ventrodorsal is best used to evaluate the lungs. For lateral thoracic X-ray, the patient should be placed in right lateral recumbency with forelimbs extended cranially and hind limbs pulled caudally, and the neck should be in a natural position. Make sure the right or left marker is present in the radiograph but does not interfere with the point of interest. Thoracic X-rays should be taken in inspiration to inflate the lungs and allow better contrast between the soft tissue of the thoracic cavity. Unless pneumothorax is suspected, then it would be suggested to take an X-ray on expiration. A ventral dorsal thoracic X-ray is usually used to evaluate the lungs. After I have entered the patient's information into the computer and selected the VD choice, I will then measure the patient at the highest point, usually around the last rib. Once I have entered the KVP and MAS based on the technique chart from my measurement, I will place the patient in dorsal recumbency with forelimbs extended cranially, with nose between the forelimbs and hind limbs extended caudally. Making sure that my marker is cranial to the axilla, I will then take my X-ray during inspiration.